and nobody's been able to help her. It was her teeth. So she's been in pain. So she has rheumatoid arthritis. She's been in pain for about 10 years. And she not only was her teeth messed up, but she had chronic infection in her mouth. So the chronic infection was causing the discomfort. So you'll see when on that video that she talks about, you know, hey, I was in pain, but I'm good now. I'm like, what she's saying, 1%. I'm at a 1 sometimes. What is this horrible picture? Chris, smile for this gentleman right now. Okay. Nice little implant. So we're happy for this lady. How does your body feels itself? Let's talk about that.
I feel better. My pain's not as much as it was before.
You're talking about your body pain that you used to have, right? And beforehand. Talk about how you actually were feeling, like your body wise. Talk about where you were feeling.
Well, I had a lot of pain. I was like, especially like in my leg.
Right.
And then, I got a lot of neck pain before.
Right.
So now it's like it's not as much at all.
Right.
Especially after removing everything.
Right. As I told you, it wouldn't be, right? What did I say? What did I tell you? I told you what? There was gonna be less pain. You didn't want to believe it. You're like, shut up. They were telling me all these doctors been telling me I got what they told you to have.
I was like, just too much. I was like, I had too much in the mouth. And
so what did your doctor say that you physically? What was your diagnosis that they were giving you?
I have rheumatoid arthritis. So.
Rheumatoid arthritis, right? That was the main thing. Mm-hmm. And so you were having pain because of it.
Yes.
So your pain was like every day.
All day long.
Mad pain. Give me from 1 to 10.
For 10, for real, all the time.
10, all the time. So how depressed were you?
Before I was like, I wouldn't smile, wouldn't do anything. I was like,
How'd you feel inside though?
Not confident at all.
Okay.
I was like, now I was like, I feel better.
You look, listen, seriously, you look absolutely gorgeous. I hadn't seen you in a while. And now like with your little makeup on, with your lipstick on, I mean, it just looks so natural for you, mama. I'm saying, I'm just so happy for you. No doubt. I'm saying, high five to that, no doubt.
Yes, I was like, fist
bump all day. You know what I'm saying? So now your body feels what? Your rheumatoid arthritis, what do you feel like now?
I was like, I feel way better. I was like, I just feel more confident. I don't have to like worry about certain things, especially because I talk to a lot of people. Okay. And work-wise and school-wise, I was like, it's doing great.
You're as far as your 10. Now, 1 out of 10, where you are pain-wise?
Now it's like it's very low. I was like, it's not nearly as much as it was before.
Like a 0, like almost a 1.
Almost.
So you still have some discomfort, a little bit.
Yeah.
But not nearly, and that discomfort. But it's not. Is it every day or just?
It just depends. Yeah.
So it's not. So at one time every day you were in pain. Like there was no day that you were not in pain, right?
No pain.
At all. So now it's once in a while.
Yeah, it's once in a while. But before it was just constant all the time.
What about your? I know your hands were.
Yeah, I was like my hands. I was like still, they have arthritis. They've been there for a while. But they're not as bad as it was before.
Can you grip better than you were before?
A little bit, yeah.
Okay.
Yeah.
And maybe with some steroids, maybe some other treatment, maybe you can, it will get better.
Yeah.
Before you leave, I want to get your doctor's information and tell them we had a mutual patient, a couple of their docs, because we want to make sure that they understand that one of the things they need to look at when they start screaming people have rheumatoid arthritis, that some of the issues they have can be also related to the mouth itself. Yeah. And so your will and testament of exactly what we're saying is that sometimes the chronic infection in your mouth can cause you to have still chronic disease or make it worse. Yeah. Okay, and so now we know that, and it's been now how long? So we put implants in you, I guess, almost a year now?
Yeah. Well, I think at the beginning of the year.
Beginning of the year?
Yeah.
Right.
Because I know back in the summertime was when we like officially started the process.
Okay.
Like putting the implants.
Okay.
Because it took me a minute to even get comfortable with it.
I know.
I was just like, okay. It took me a minute to even debut them at school, and once I did, I was like, just the like comments, they were like, they made a little boost in my day.
Yeah.
I'm like, okay.
So people are saying you have a nice smile there?
Yeah.
So that's a whole big difference for you now, right? You'll say, oh my God. But you know, more importantly, it's not even just the smile itself, it's the health, right? Yeah. You know what I mean? So now you are completely healthy, your body feels healthy, and that's what people understand. Like, it's just, they don't, most dentists and most physicians are not aware of truly how important it is and how chronic infection in your mouth can at least extend the pain that you were having. And so immediately after we pull your infected teeth, you know, now you feel better.
Yeah, because I was constant, and I was like, I wish I would have had somebody before, even years ago, to even explain what the dangerous parts of not taking the teeth out. Because it was.
See, I almost want to say that again. Yeah. She said she wished that she would have, and I think that the crazy thing is for us and for me is that unfortunately, 99% of dentists have no clue that we can help our patients. Physically, you know what I'm saying? Everyone's saying, "Oh, I can get you some cosmetic, and let me go to was it Costa Rica, Colombia, and give me some new teeth, whatever else." But no one understands that it's really about the bacteria here and the chronic infection here that can cause the problems here. And I'm just so happy that we were able to help you. That's so amazing. All right, good. Now I'm at what she said, 1%. I'm at a 1. Sometimes. That's amazing. That's something. I mean, for somebody who's been in chronic pain, imagine you're in chronic pain every single day. Like every day, you literally are in somebody's Dollar General store trying to find some Tylenol because you're in pain because you can't take it. You know what I'm saying? You get aspirins every day. Now you're addicted to the aspirins. You know, it's just crazy. So to be able to actually show that the two causes can cause these problems, that's amazing. So I'm excited I'm excited for her, and I'm glad we were able to help her. And she was glad that she came to see me, the cowboy did.